Delft Imaging envisions a world in which everyone can benefit from the modern advances in healthcare. Tuberculosis is one of the deadliest infectious diseases in the world, killing 1.4 million people per year. CAD4TV, the software developed by Delft Imaging, is a software program which analyzes a digital chest X-ray and gives an indication if someone has tuberculosis. CAD4TV works in the following way. First, the patient's lungs are X-rayed, after which a digital image of the patient's chest is generated. CAD4TV creates a heat map of patient's lungs and displays an abnormality score from 0 to 100. A high abnormality score may indicate tuberculosis. Delft Imaging is trying to reach the sustainability phase at the moment, but let's recapitulate and see how the company has successfully accomplished all the growth stages and overcome the critical junctures. It all started with a research phase in 2001, when Professor Bram van Ginnerken defended his PhD on recognizing patterns in X-ray images to detect tuberculosis. Once they decided to develop the product, they faced the first critical juncture, obtaining a sufficiently large set to train the model. They overcame this juncture by letting doctors use the X-ray imaging systems for free in exchange for data acquirement. Delft Imaging, together with Radboud UMC and the Lung Institute in Cape Town, developed the first pilot project, where they could validate their product for the first time. Once validated, the critical juncture phase was to obtain the acceptance of the medical field. It is laborious to introduce high-tech in this sector, as doctors tend to refuse the change, especially with AI. In order to obtain this acceptance, the company provided a large amount of scientific proof using new projects in different countries, such as in Ghana and Myanmar. At this time, the CAD4TV got CE certified, resulting in the product being used on a large scale. At this point, the first competitors arose to the market. Delft Imaging managed to differentiate by implementing CAD4TV in regions where there is no internet, a detail other companies underestimate. Finally, in 2015 and 2016, there was a vast project in Pakistan in which they screen more than 1 million people every year. Delft Imaging now obtained sufficient credibility and received the first funding from NGOs and governments. More than 8 million scans have been performed with the CAD4TV. In the evolutionary model, we can see that the innovation phase took around 10 years from the first publication to the first large pilot test in 2011. After that, during the adaptation period, they had some minor projects where they continued improving and developing the product. The large-scale diffusion started when they obtained the CE certification. When looking at Delft Imaging, the entrepreneurial mindset was not a problem, as the CEO was very optimistic, focused, driven, and highly independent. Concerning entrepreneurial motivation, the team of Delft Imaging had a high tolerance for ambiguity and high cognitive motivation. Secondly, there is the seeing entrepreneurial goal. As of Delft Imaging, much knowledge was required in the industry as they entered the new field of artificial intelligence. Within this industry, success was based on both financial capabilities and relationships. The final and third goal concerns acting entrepreneurial. Delft Imaging created value by coming up with a new AI technology when it was much needed. Delft Imaging built the right team for the job with a highly interdisciplinary group in which team members complemented each other. Our customer's job is to diagnose tuberculosis in a large population. This can be done with chest radiographs, but the scarce professional human readers force them to rely on bacteriological tests, which are expensive and take a lot of time. These are their main pains. CAD4TV solved this problem by offering a software that can detect tuberculosis from chest radiographs automatically, as if you had a virtual expert human reader on site. Delft Imaging had to overcome the reluctance of international institutions to recognize AI as sufficient for carrying out a diagnosis. Delft Imaging also follows a standalone niche strategy because they aim to provide a product that had no competition whatsoever and was actually trying to bring a totally new concept to the market. But if they were to re-enter the marketing right now, the best strategy they could follow would be a hybridization strategy. Bringing in many technologies and being able to provide customers with more diagnosis tools would imply that Delft Imaging's product should be the smarter choice to invest in, giving them an edge again. The total addressable market, considering all X-rays taken around the world, is about 3.6 billion, but not all of those are chest radiographs and for screening tuberculosis. The serviceable available market is estimated about 5.8 million people. 30 countries around the world accounted for 86% of all new tuberculosis cases, and 8 countries 2/3 of the total. Delft Imaging has a presence in 4 of those countries. Considering this number, our rough estimation of the service obtainable market is 1.6 million people per year. Delft Imaging business model canvas has evolved during time. An ambitious value proposition has driven the success of Delft Imaging over the years, accompanied by strong partnerships and key activities. Changing the revenue streams in order to establish the United Nations as one of the channels was one of the biggest modifications in the business model over the years. At this moment, the company has over 100 projects in more than 64 countries. The latest innovative project from Delft Imaging is the Baby Checker. This is a low-cost ultrasound probe that you can plug into a smartphone and that works with an app that has a powerful AI system under the hood, checking for risk factors in pregnancies. Philips has already tried to bring a similar device to the market, but without the incorporated AI system, and therefore the device failed to meet its purpose. Because of Philips' history with ultrasound probes and Delft Imaging experience with AI, Delft Imaging and Philips could bundle forces to co-create the Baby Checker. If Delft Imaging and Philips would merge, this would bring Delft Imaging automatically in the sustainability growth phase, as in the case for many healthcare startups where they are bought off by one of the big healthcare companies.